So this is really one chapter in a book which is entitled a fabulous failure, a fabulous failure, Bill Clinton and American Capitalism, which covers many topics, trade and industrial policy and financialization and budget politics and labor, et cetera, in the 90s, really. And the sort of the argument is, just to put it in a very crude nutshell, Bill Clinton did not enter politics or office as a neoliberal. He had many other ideas and people around him, kind of what I call industrial policy reformers. He ended up a neoliberal, undoubtedly, no question about that. But the interesting thing is to see how that happened. It's not just to label him or all the people around him, et cetera. So this is on healthcare is one part of the book, and so I want to talk about that. It really, in some ways, is the heart. It was the most ambitious thing that the Clinton people did. It would have a legacy which would have an impact, and you'll see that on what Obama eventually did. But I think, in a way, why it failed is interesting as why it might have succeeded. And I think again, this is sort of in writing about the Clinton era, it's sort of at that borderline between memory and history and journalism and just just emotion almost. Anyway, so many Clinton and many liberals and others thought that the time had finally
here,
come.
So I guess you can stay.
Can you hear me? What? What?
Silvina, you need to mute. I'll tell her. Go ahead.
Okay. Oh, sorry. Yeah. So Clinton and his and many liberals in this era thought that the time had finally come for a universal system of health provision. And one reason they thought that is that it was not just that, the many maladies of the American health system. And here I have I'm not an economist. You'll notice that. You'll see that I use statistics in a kind of illustrative way. But you've seen these. Here's the uninsured rate. Look for the 1990, that period. It's going back up. These are all well-known things. I'm sure you know. Here, total health expenditures, are going up in the 90s. There's sort of a spurt in the 80s and 90s. You can just see that. And here, from the Clinton point of view, the liberals around Clinton, what I call the industrial policy liberals, this chart may be even a little more important because it's really it makes it clear that the United States is an outlier. We're spending much more, per capita and percentage of GNP on healthcare. And from the Clinton point of view, and his supporters in business as well as on the left, this was a period, the late 80s, in which the argument was being made, as one candidate for president, Tsonga, said, the Cold War is over. Japan and Germany won, So there's this sort of sense of international competition was very strong, and healthcare seemed to be one of the big problems. So the Clinton people thought that they now had a moment when capital was going to be an ally in reforming healthcare, because it was becoming such a burden on business, and especially, of course, on manufacturing, unionized manufacturing, which was, when we're talking about, this is the period when the hysteria about Japan passing the U.S. was there, and that had a lot to do with cars and Japanese imports. So this was a period when that was taking place, and you're aware of, I'm sure you're aware of the things like, a car company executives say we spend 3 times more on health insurance than on steel. So how could we possibly, beat the Japanese or the Germans at that? I mean, here, for example, is I talked about this. One of the companies that was that the Clinton people, the liberals and the health reformers saw, okay, as a characteristic company was Chrysler, which had gone into almost bankruptcy in 1979 and 80. It had been aided by the government to come out of bankruptcy, but it was a so-called legacy manufacturer, unionized, of course. And Lee Iacocca, who was kind of the celebrated and kind of celebrity, really, head of Chrysler, was just beside himself with the burden of health insurance that was just so much. And of course the companies had different strategies so they could crack down on health insurance, and he tried to get the hospitals in the Detroit area to charge less, tried to force the his employees to pay more. Those things didn't work. They worked for a little bit, and I'll indicate I have I'll show you a slide about that later on. But so here's Iacocca, and he brought onto the board of directors of Chrysler Joseph Califano, who had been Jimmy Carter's head of health, education, and welfare, indicating they were going to take serious, and Chrysler was going to, among other companies, going to lead the way in trying to figure out some governmental response to this healthcare crisis. Chrysler is one of several manufacturing firms, steel, auto, etc., trucking, that really wanted to have a war against healthcare costs and wanted to enlist the government to help them out with it. The UAW's Douglas Fraser, who was also at this time on the Chrysler board, he had been president of the UAW. He said Iacocca talks like an Italian socialist, when it comes to healthcare plan. Let me just go and just mention here. So again, this is part of what I call the idea of industrial policy is part of the Clinton kind of intellectual, ideological toolkit. And he brings people like Robert Reich, who become his Secretary of Labor and had been close to Clinton for a long time. This idea that the government has to help shape markets, provide incentives, and not just in the Republican fashion, lower taxes, but in a kind of more directed fashion. And now that they have companies like Chrysler and others on their side, maybe you can have a kind of corporatist deal, as it were, that could do this. And corporatism meaning, a cooperative bargaining relationship between big business, between labor too, to a degree, although labor is getting weaker, and then the government. One figure here who will play a big role he'll be head of the Clinton task force on healthcare is Ira Magaziner. Maybe you've heard of him. He's not as famous as Robert Reich, but he was a classic kind of figure of this period. He comes out of the New Left. Let me just okay. He comes out of the New Left at where's the picture? Yeah, here's a picture of him, Brown, being a bit of a rabble-rouser. He went to Brown. Anyway, came out of the New Left, then went into business consulting, not because he was selling out. He didn't think that at all, but he could see by the 1970s that yes, there's a huge problem in American competitiveness, American business. He thought he'd bring the tools of the New Left, the kind of organizational and innovative tools of the New Left, and kind of non-capitalist sort of ideas, and use that to help revitalize American business, working with the Boston Consulting Group. And then he could see in the 70s and 80s, he could see that health insurance costs are a huge competitive problem for American business. So he will be tapped by his good friends Bill and Hillary to lead up the effort to reform health insurance under the Clinton administration, and that's what he does. That's okay. So, but I want to say at one point here that one of the themes in my book and in this talk is that, in fact, business, well, you'll see multiple ways in which business capital is divided. And one, of course, is between old line manufacturing, which is often a high wage and high benefit and often unionized. And then the rise of a whole retail service sector, which is just, don't even talk about finance for the moment, which is usually what we think of neoliberalism, but Walmarts and Marriott's and all of the retail hotel service sector, restaurants, and which is low wage, low benefit, non-union, and when it comes to health insurance, very, very skimpy on that. I just want to show you one other slide here. To give you an indication of the crisis here. This is I don't know how you remember this from your history books or from your life, the 1989 Pittston strike of a coal company in Southwest Virginia, which was a brutal strike. It went on for several months, many arrests, lots of violence, and the whole issue was health insurance costs. That was the whole thing. What's interesting here, if you look at these pictures of these people, Southwest Virginia, just in the last election, went like 80% for Trump. It is the Trumpiest area in Virginia. Well, here 30 years before, it's an absolutely, cockpit of working class militancy. So I'm not going to get into that, but that's just to give you something of the stakes that we have here in terms of what's going on. Let me see here. Well, okay, here's my little, again, as you see, I'm not much of I'm not an economist, so I just like little symbols and little kind of mnemonic devices here in the way in which the American economy, part of its divisions at this time, which were very obvious, were these high wage, high benefit industry versus low wage, low benefit service sector, symbolized by Chrysler versus Marriott, or you could have Ford versus Pizza Hut, etc. Actually, where do I have that? What happened to my? I thought I had another one here. Yeah. Okay. Let me see here. I want to actually. I'll just show you one picture. Here's Hillary. In her younger days, she was the titular. This is thought to be a tactical mistake that Clinton made. Maybe he made his wife head of the official head of the Health Care Task Force in the administration. Probably was a mistake because she was in effect unaccountable. That is, she couldn't be fired really. So Magaziner did all the work. She was the symbolic leader of it, and of course she became demonized in the course of this. But nevertheless, initially Hillary was terrific at this, and I would just say that in the early fall of 1993, after the healthcare plan had been introduced, everyone thought it would succeed. The Republicans, many Republicans, the business for sure, the liberals, and she had been an extremely effective spokesperson for this. So it was maybe, well, you can, whether it's a mistake or not, but this was thought to be a plan that could work. Let me just go on. This goes to my slide. Oh yeah. So here are the elements of the Clinton healthcare plan. There was a rejection of single payer. Hillary famously said that, get serious, liberals, that's not going to work. We live in a capitalist society. We have stakeholders who are absolutely committed to private insurance. So we can't do that. But as I'll indicate in this paper, the Clinton plan would become de facto single payer, and I don't think, and that has because of the logic of trying to reduce healthcare costs. I'll get to that in a second, but anyway, officially rejection of single payer, meaning the government would pay for it all. Secondly, there was a mandate on employers who would have to offer health insurance. Now, again, Chrysler was and U.S. Steel, they were perfectly happy to do that because they were already paying lots of money for health insurance. That was no problem for the old line manufacturing. The people who that was a problem for would be the Pizza Huts and the Marriotts and the Walmarts of the world who didn't want to have health insurance or had very skimpy health insurance. Third, there would be really a regulation of insurance, and here the Clintonites were banking on the support of this plan with the very biggest insurance companies, the so-called Big Five, which included Metropolitan Life and Prudential, et cetera, against all the little insurance companies. The business model of the big insurance companies was, well, we want lots of new customers. We're willing to take a certain amount of regulation. We're going to monopolize the market. We're going to become more than insurance companies. We're going to also be providers of health services. And that was very different from the smaller health insurance companies, which were basically, I call cherry picking, meaning that's the word for underwriting. That is, they only want the healthy and the young and those who aren't going to cost them money. And so the big companies were willing to have what was called guaranteed issue, or essentially universal admission, universal purchase of health insurance with no questions asked. So this was a big division. There was a group called the Health Insurance Association of America, which had included everybody, but by 1991-92, it splits, and the big companies leave it. And this HIAA, Health Insurance Association of America, is only representative of the smaller companies, and they, of course, are bitter opponents of the Clinton plan. All right, and I'll get to that. Get to them in a second. Fourth, one of the ideas. Let me see where do I go here. Here we go. Was this so-called managed competition. Managed competition. This was a sort of a new idea. It came out of this group called the Jackson Hole Group, which was composed of insurance executives and economists. Let me just read the paragraph on this. So maybe the Jackson Hole Group were the most prominent proponents of managed competition, meeting periodically in the vacation home of Paul Elwood, who'd been active in health policy circles since the Nixon administration. This study group, whom health industry cabal put in the same room high officials from the most powerful insurance companies and representatives of the hospitals and other providers with whom they were often in contention. The guiding spirit was Alan Enthoven, a Stanford economist and Pentagon defense intellectual under Robert McNamara, who sought to redeploy RAND Corporation systems analysis to welfare state public policy. He was one of the architects of the whole rational expectations school of economic policymaking. Enthoven understood that individual consumers of medical services were both powerless and ignorant when it came to making health care choices. Consumer choice had to be executed when purchasing insurance, not when seeking medical care. But at this point in the market exchange, consumers needed organization if they were to participate on any sort of equal or efficient basis. So the Jackson Hole Group therefore favored governmental management of the insurance market. This would take place not at the level of the individual or firm, but between giant health insurance purchasing cooperatives, HIPCs, and the large insurers, who would now offer standardized plans that met federal benefit standards. All companies would be mandated to offer health insurance to their employees. Advocates of a Canadian-style payer system call the Jackson Hole version of managed competition a last-ditch effort to preserve a role for the insurance industry in healthcare. And that's true. That was certainly true. And Bill Clinton and Ira Magaziner endorsed it. Bill Clinton said, this is a private system. It's not pay or play, meaning that the government's mandating costs. It does not require new taxes, and that was very important. Clinton didn't want to do that. Very different from the Obama plan, which did have lots of new taxes. It will preserve what is best about our present healthcare system. So, I mean, it's remarkable actually that this Jackson Hole group became so influential so quickly. And by the way, I want to say one more thing. One of the things later on scholars would say about the Clinton plan, one of the reasons it failed, is that new ideas, and it was endorsed by the New York Times and by all the many business lobbies as well, but new ideas need really decades of germination and working out the bugs, you know. But when it came to Medicare and Social Security, there had been liberals and economists and all sorts of politicians who've been working on these things for decades. But managed competition, this idea just sort of sprang, you know, within a year, and it really didn't. It hadn't been thought out, worked out. Robert Reich said, "I don't entirely understand it," you know, and he would have been someone who would definitely be an advocate for it. One reason I put in here managed competition, purchasing alliance for the uninsured and for small business. Now, one reason I put small there is because the definition of what was a small business would become very important, because from the Jackson Hole perspective, and which means really the big insurance companies and some of the, they wanted small business to be really small, you know, 100 workers or something like that, kind of, you know. But it became apparent from Magaziner's point of view and others that small had to be bigger, like 5,000 workers, and to really make these purchasing alliances have any real clout, any real power to negotiate with the insurance companies. So once you go to 5,000 workers, then you're talking about a purchasing alliance sponsored by the government, which is going to have 95% of all purchase of insurance within it. And then you're getting close to a government single payer, you know, plan. That's the one point I want to make, and that'll come up. I'll get to the budget ceiling in a second here. So, okay, let me just say, okay, one of the things here, ideologically, managed competition was designed to embrace the market, but politics and political economy drove it to the left. I'll repeat it. Ideologically, it was designed to embrace the market. That was the whole point. That was what, you know, but the politics of health insurance drove it to the left. Right? So here I have, okay. So what happened? Okay. One of the ideas of Magaziner and Clinton was that we're going to have, yes, managed competition, and there'll be negotiations over health insurance, but we can't let prices go out of sky high. So we've got to have a global budget, a top line budget that you can't go above for health insurance in any given. This is on a regional basis, by the way. It was sort of a non-market assurance that costs would be held in check. Okay, but this was just for the first couple years. Magaziner thought that after a while, this budget cap would become superfluous because market forces would take over, and they would ratchet down the overall cost of health insurance. Well, to get this through Congress, it had, you know, just like today, the Congressional Budget Office, you know, has to score these things. Right now, they're scoring the Biden infrastructure plan and whether or not, you know, more enforcement by the IRS will help pay for it. Well, the same way the Congressional Budget Office was called in to you know, determine in part whether or not, in fact, competition would in fact pull down the costs and make the plan work. The Congressional Budget Office had been a liberal institution created in the 70s, really as a way to force Nixon to you know, not just sequester funds and not use them. They were kind of it was a liberal institution, but the CBO wouldn't buy into they wouldn't buy into the theory of managed competition. I'll just read this. By the early 90s, the CBO scoring of any prospective law was politically and fiscally essential, both to gain some sense of its cost and the taxes that might therefore be needed to pay for it, and as a nonpartisan certification that could and would be deployed as a statistical bludgeon by friends or foes of the legislation. Thus, on February 2nd, 1993, the appearance of CBO Director Robert Reichauer, there he is, before the House Committee on Ways and Means was a decisive moment in the fate of the Clinton health security plan. Reichauer was a health financing expert, very well respected, but he couldn't say if managed competition would in fact flatten the ever-rising cost curve. He said, we are talking with respect to the managed competition model about a structure that does not exist anywhere in the world. And it would be wrong for me to say, I know that what is going to happen. I know this is going to play out. The whole experiment was a pig in a poke, Reichauer said. And he did not want to take Congress on the budgetary equivalent of a bungee jump. But Reichauer made it clear that it was not really the nascent quality of the managed care legislation that made a cost estimate difficult. Instead, it was much more fundamental. Markets themselves were inherently indeterminate, subject to political and economic winds involving thousands of decisions among multiple actors. In contrast, the CBO was far more confident that it could score the cost of a single payer mechanism if there were a global budgeting for hospitals and other larger providers. Experience with Medicaid and Medicare, which are single payer, had shown that the more efficient mechanism for holding down costs are also the more intrusive ones. Markets were fuzzy and indeterminate. The CBO judged the health plan's cost containment mechanism on how clear, specific, and automatic and enforceable the regulatory provisions were. And I should say Hillary Clinton may have agreed after a February 23rd White House dinner with her close friends. She said to her husband, she thinks managed competition was a crock of shit. A single payer was necessary. Even though this was at the same time she's attacking liberals for single payer. So at one point, again, Reichauer says we have to use sovereign power of the state to hold down, to make this global budget work. In other words, he's saying anyway. He's nonpartisan, but he says if you really want to hold down, you have to use, very intrusive, basically state power. Now the Jackson Hole group, when they realized what Reichauer was saying, when they realized that what global budgets are really doing, when they realized that these health insurance purchasing cooperatives were going to take over 95% of the entire market, they realized that's single payer, and Alan Entovian, he writes an article. He says the Clinton plan is a single payer system in Jackson Hole clothing. In other words, they'd invented the system and now they're repudiating it. And that was also a kind of, in that basically the big insurance companies were getting really nervous because we were getting to de facto single payer. That's what's happening. Okay, they call it in effect a single payer system. Now, the second thing was, here I have a picture of Bill Clinton. This is from one of his speech, I think a speech in September of '93, where he is introducing the plan in a big way. And he says, he knew by this point, managed competition, what the hell is that? No one knows what that is. That's not going to, make any no support for that. All the details were just, ridiculous. But he's holding up a card there, and the point was going to be, he says, with this card, if you lose your job or you switch jobs, you're covered. If you're an early retiree, you're covered. If someone in your family has unfortunately had an illness that qualifies as a pre-existing condition, you're still covered. I mean, driving, he was pushing for universalism, and he ended with an evocation of FDR's greatest social achievement, the creation of Social Security. And, and he says, 40 years from now, we're going to look back at this day the way we look back at Social Security. It's a universal system. So I mean, while the details of the plan didn't change, Clinton is projecting it as this, far to the left of what Obama would do. It's going to be a universal system. Now, how much time do I have? How am I doing it? Claire, am I okay? Hello?
Yes, you're doing. I mean, you now you spoke for half an hour, so
okay, I'll
if you want to go, no,
yeah.
there's no problem. We have until 2, so I think
Okay.
10 more minutes
That's
is
fine.
absolutely
Okay.
fine. Even 15.
So there was still a great deal of support for the plan, but as it shifts to the left, that's one thing that happens. And then, now I want to talk about business. What is business? What are the various fractions of capital have to say about this plan? And they basically bail on it. That's what happens. Okay. The first, what happened was the right wing of the Republicans. The right wing of Republicans took over the battle against the Clinton plan, away from the more centrist Republicans, which included Robert Dole and Lincoln Chafee and others. There had been a centrist, even liberal Republican element. And so people like Newt Gingrich, who's on the verge of taking over the Congress, but before that happens, they begin to take over the kind of the fight on health insurance. And one of the key ideologues of this, a guy who's now on TV and appears like a liberal, but it was in those days, was Bill Kristol. Let me get you Bill Kristol. Where's he? Oops, I'll get there. Here's Bill Kristol. And Kristol is a real, ideologue for the right wing of the Republican Party at this time, and he makes the point. He says, "Look, whatever the benefits of this Clinton plan to American business, and there was as I said, the old line manufacturers and still the insurance companies, many of them were still behind it. This is going to legitimize a new generation of social spending, and it's going to re-legitimize government itself. I mean, it's precisely what Joe Biden's trying to do right now. And today, of course, Clinton kind of endorses the Biden plan because he sees the problem. You don't have Biden, you have fascism, is basically. But anyway, at this time he makes this argument. The statement is famous, and you've probably heard it, and he puts it forward. And it had a big impact inside the Republican Party, a big impact. Let me see. Well, I'll read it. The ideological mobilization of conservative Republicans might well have been for naught had Clinton's Health Security Act retained support from those sectors of American capital which had been designed, been designed to serve. Almost a generation later, wall-to-wall Republican hostility to President Obama's Affordable Care Act did not derail that health reform scheme, because in 2009 and 2010, all the key players, the doctors, the hospitals, nurses, big pharma, old line manufacturers, and the retail and fast food employees of low-wage labor remained on board for the Obama plan. And we can talk about that later, why that's the case. But in 1993 and 94, most of those would defect. Their interests had stood at the center of Magaziner's calculations, because no grand corporatist bargain could be constructed without accommodating the core economic and organizational interests of US business, still responsible for 2/3 of all health provision enjoyed by American families. And it was never just a question of economics, because corporate support for the Clinton Health Security Plan opened the door to the kind of managed capitalism Bill Clinton and a good slice of those who held policymaking posts in this administration had sought to advance. So by Kristol's sort of attack and really forcing the moderates in the Republican Party to abandon ship, and then what happens is the Republican Party begins to lobby. The party lobbies business. not the other way around. You think of, the Chamber of Commerce and whatnot lobbying the party. No, in this case, it's the party that lobbies the Chamber of Commerce. And let me see if I have a thing here. Where is my? Yeah, here. Okay. So I have in my paper, I have this long discussion of the Chamber of Commerce, which is a major business association. It had been in favor of the Clinton plan because many of its companies would in fact save money, and certainly the manufacturing wing, and Magaziner had a kind of constructive relationship with chamber people, modifying the plan to their likes, willing to compromise, but basically, and the chamber people had started to had defended the plan in front of Congress. Well, the Newt Gingrich and the right-wing Republican parties, they began, not just to lobby the chamber, they go out into the states and try to convince local chambers of commerce to quit the chamber. They start. It's just the opposite of what you think of, with a business lobbying the congressman. It's the other way around. And I don't have the details are in my paper, but basically what happens is, just one example, the chamber had always given a Spirit of Enterprise award to Republican congressmen at their annual dinner. That was a big deal, they'd given that award. Well, Gingrich persuades the Republican Party to boycott the chamber dinner where they're being honored. Anyway, so the chamber caves, basically. They implode, and in early '94, and just as they're on the verge, literally, of giving testimony that will support the Clinton plan again, they basically fire their congressional lobbyists and basically just move away. It's really and it happens in all of the major business groups. They've been in support of the Clinton plan, the Business Roundtable, the Chamber, the National Association of Manufacturers, who are going to save a lot of money, and there's kind of internal revolts within each of these business organizations, partly pushed by the right-wing Republican Party, but also pushed by some of the smaller and more labor-intensive firms, as well as the big fast food firms, etc. And you get these internal revolts within all of the business organizations. And so the key premise of the Clinton plan, which was that we're going to rely on business because it's in their interest to pass this thing, that collapses. And of course, then there's this famous. The famous Harry and Louise ads. Even if you're only 20 years old now, you probably heard of these because they're so famous. And these were put out by that Health Insurance Association of America, the coalition of cherry picking health insurance firms, not the big five, but it was a way of. They're extremely effective ads that it's very clear it's here that demonize governmental regulation and etc. I say here I have a slide on here's Newt Gingrich versus the Chamber's Richard Lester. That was sort of a big fight that went on. Well, I'm going to stop here. Pretty much. I think let me just say. Let me see. Yeah. I'll just conclude by and we can maybe we can talk. I can say what later on, maybe in the discussion we can talk about what Obama learned from this failure. But here's the last thing. Our biggest setback in any area has been with the large business community, where we expected better support. Magaziner told Hillary and Bill after the Chamber and the National Association of Manufacturers had gone into opposition. Without big business, wrote the journalist John Judas, what would have been difficult became impossible. Healthcare reform was doomed. Obama wouldn't make that mistake, but we can talk about that. Thank you.